Good evening. My name is Sharitha Massey, and I'm doing a PowerPoint presentation on a whooping cough outbreak. The point of the PowerPoint is to show how we would identify, diagnose, contain, and treat the outbreak. Whooping cough is defined as a contagious bacterial infection that affects the lungs and causes uncontrollable cough in most people. It's called whooping cough or pertussis. This is a preventable infection if treated with the Tdap vaccine in childhood. The vaccine is also available for adults, but it's recommended at infancy and through early childhood. A plan of action for trying to identify and contain this outbreak would be to contact the CDC, the WHO, and Doctors Without Borders, WHO being the World Health Organization. Find out the confirmed number of cases, the area that the cases are confirmed in, and try and help fight the outbreak before it spreads any further. The hospital needs to prepare its staff for such an outbreak and prepare them to protect themselves, and request protective equipment for staff and take precautions for uninfected patients. We also need to prepare a quarantine area for those infected. The leadership role that I think should be used during this process will be the participative role, which needs to include everyone that has a part in this epidemic, trying to keep it from spreading, which would be the trained medical professionals, the CDC, the Doctors Without Borders, the WHO organization, that would all be able to lend a word or a helping hand into the help with the diagnosis, identification, containment, and treatment of this illness. Innovative processes needed. One of the first steps would be to contact the hospitals and medical facilities outside of the affected area to inquire if they have any vaccines or antibiotics that would be needed to treat the infection. Make sure everyone affected is aware of the risk to public safety and quarantined immediately. Create outposts to keep infected from coming in contact with patients at the hospital that are not infected, and make sure there are trained staff to perform the testing and diagnosis as quickly as possible. Sorry, I just did that one. I think there should be some sort of information given to the public, alerting them of this outbreak so that they will know that there is something that's being spread around. Try and do it in as casual a way as possible, which I don't know how easy that'll be, but to try and keep people from panicking and to try and keep everyone from running to the hospitals and facilities if they don't have these signs or symptoms, which takes up time and resources that could be used for someone else who does need that assistance. Shortages and strategies. The public needs to know that we're doing everything we possibly can to get these antibiotics and the vaccines that are needed to help with the outbreak. And they need to be aware of the overcrowding of the facilities and not to come to the facilities because they've developed a dry cough in the last 5 minutes because they've put themselves into a panic. Ethical treatment of the infected. I think there should be a way that we go about the process of treating and vaccinating people. I think the elderly, infants, and children should, of course, be the first to go because they're the most vulnerable during this time. And we would have to explain that to everyone and let them know that this is how the procedure would go, and we will get to everyone as quickly as possible. We will not neglect anyone during this process. The CDC and Disease Prevention and Control will be the ones to make that decision on who gets to go first during this process. Solutions for future containment. I think there needs to be some education for vaccinations, and we need to petition the courts to start a law to where people that decide they don't want to be vaccinated cannot infect other people that do choose to be vaccinated, because it's not fair to spread infections that are preventable and could possibly be life threatening to people that choose to get vaccinated. Thank you very much.